Hello and welcome to episode 7 of Harmonious Psychology Solutions series on menopause and part 2 of our episodes on mental health and how it is affected by menopause. In this episode, we're going to be covering some more mental health conditions that could be caused by and exacerbated by menopause. So menopause does not cause bipolar, but it can make bipolar worse if you already have it. It's important to remember that not everyone who has bipolar before menopause gets worse during perimenopause, but the decreases in estrogen can often cause lower mood, irritability, and anxiety, which are symptoms of bipolar. And women with bipolar are more likely to report depressive symptoms during menopause than women who do not have bipolar. If you are already receiving treatment for bipolar, it is important to ask your therapist or doctor how menopause could affect the treatment. Commonly used treatments for bipolar are cognitive behavioral therapy and medicines which prevent episodes of mania and depression, which are known as mood stabilizers, which are taken every day on a long-term basis, as well as medicine which treats the main symptoms of depression and mania when they happen. These medications are also safe to be taken with hormone replacement therapy, which would increase your estrogen. It is also recommended that living a healthy lifestyle, which includes regular exercise, good quality sleep, and a healthy balanced diet, can also help with bipolar. Some foods which are specifically recommended for bipolar are chia seeds, ginger, cashew nuts, broccoli, blueberries, spinach, bone broth, lean proteins such as fish, and healthy oils such as avocado or coconut, as well as consuming lots of water, vegetables, and high fiber foods such as legumes. Avoiding sugar, carbohydrates, fried foods, E-numbers, preservatives, alcohol, coffee, nicotine, pork, and excess red meats are also implicated in the improvement of bipolar symptoms. Another treatment for which there is some evidence for its reduction of bipolar symptoms is acupuncture. Schizophrenia is another mental health condition which can be worsened by menopause. During puberty, the fluctuation of hormones creates an increase in schizophrenia diagnoses, and the same thing happens in menopause. The most common symptoms of schizophrenia during menopause include hallucinations, disorganized thinking and behaviors, paranoia, and flat affect. Schizophrenia is usually treated by using a combination of medicines and talking therapies, such as interpersonal therapy or systemic therapies. Hormone replacement therapy has also been found to be effective in reducing the symptoms of schizophrenia during perimenopause due to its control of hormone levels. Alternatively, increasing the levels of glycine in the diet is thought to help reduce schizophrenic symptoms. Sources of glycine in the diet include meat, fish, dairy, and legumes, but supplements are also available. Ginkgo biloba is a herb which is currently being researched with possible evidence for its use in the management of schizophrenia. During menopause, the adrenal glands take over some of the work of the diminishing ovaries and produce small amounts of progesterone and estrogen. However, the adrenal glands cannot produce these hormones efficiently when they are constantly pumping out stress hormones, as the body will always choose survival over fertility. When we experience stress, the body becomes primed for attack, and the adrenal glands choose to produce cortisol and adrenaline over the production of estrogen and progesterone. This is bad news for menopausal women, as these hormones are needed to maintain health and emotional well-being. In this way, stress exacerbates the symptoms of menopause. Meditation, breathing exercises, and yoga are great ways to de-stress, as well as sound and vibration healing, which can guide you into a meditative state which relieves tension. Some of the main benefits of sound healing include immediate reductions in anxiety and stress levels. Healthy lifestyle factors such as diet, sleep, and exercise can also help to reduce the effects of stress, as mentioned in previous videos. Planning ahead and using time management techniques is also a great way to prevent the causes of stress, although I appreciate that this is not always possible. And finally, to combat stress, you can use mindfulness techniques such as a body scan. When you do your body scan, start off by taking a single deep breath in through the nose and out through the mouth. You can keep your eyes closed or open, but make sure that you notice where your body is, the position of your body, and how your body is feeling. If you feel any tension in any muscle, try to allow it to soften and adjust your body as needed. Go through each muscle individually, acknowledge its presence and any feelings you experience within it. You can take as long as you need with this exercise. While low self-esteem isn't considered a mental health problem, it is certainly a contributing factor to other mental health problems. During menopause, low self-esteem can be caused by multiple factors such as age and hormone-related body changes, changes in brain function and cognition, and the low mood and anxiety caused by hormonal changes, all of which may cause you to become self-conscious and self-critical. To increase your self-esteem, try taking part in exercise or physical activities such as sports, walking, or yoga. This not only causes a serotonin boost, which makes you happy, but can cause changes in your body, which will make you more confident in yourself. When you think negative thoughts about yourself, make sure you catch them and correct yourself. It is not helpful to criticize yourself and will only make you feel worse. What's more is that these criticisms are often unnecessary and you should focus on the things that you like about yourself instead. One way to make sure that you do this is to think of 5 positive things about yourself every day. This can be positive things about your personality, your achievements, or you can even look in the mirror and identify positive things about the way you look. Doing things that you are good at within your sport, hobby, or at work can also help you to gain confidence and feel good about yourself too. Once again, here's some useful research papers if you'd like to learn more about any of the topics covered today. We hope you found this episode both enjoyable and useful. I would love for you to join us in our next episode about the effects that menopause has on hair, skin, vision, and hearing. See you next time.